have the privilege of hosting Dr. Ruchika Sood, our director and founder of Neocare Orofacial Pain Relief Center. Now, before we dive into the intricacies of pain, I want to highlight something unique about Dr. Ruchika Sood's practice. She runs an all-women's team in her center. Dr. Sood, can you share more about the story behind this? Was it a deliberate choice or perhaps a plan set in motion by the universe?
I think it's designed by the universe. It's said that success itself is designed by the universe. We just followed guidelines, and one thread kept getting connected to the another, and we have Neocare today the way it is.
That sounds interesting. Well, talking about women, doctor, why do women often find themselves dealing with pain more frequently than men? Can you help us understand the factors with it?
Yes, the pain part of life is always with women. Either they are at the receiving end or they may be at the giving end if they choose it. Like, if you say no to somebody's proposal, you've broken a heart and the woman has given the pain. But the opposite is sometimes also true. So jokes apart, women suffer more because of the constitution. The nature has made a woman to be a nurturer, and the hormone profile of being female is different. The body functions vary based on the endocrine profile of the female, and hence they are more susceptible to pain problems. Women are more emotional, they're more sensitive, and all these things add up to the pain problems. And also, I think social conditioning, the way prioritization happens in the country. I think it's a decade of being in practice in India, and the fact that every Women's Day there is a headache screening camp, and I'm yet to meet a female who walks in saying that she has a headache which she thinks is a problem. Every woman consistently year after year has said that because it's a camp, she walked in and she thought she will understand it better. मुझे normal वाला headache है. ये normal वाला headache क्या होता है? Medical science is still searching for it.
Well, so being here, I have seen orofacial pain being so elusive, something that hides in the crevices of mouth, jaw, and face. So, can you tell me why orofacial pain is still a riddle that captivates us?
So it's hiding in the crevices because not enough of us are digging for it. Orofacial pain is a very evidence-based and scientific specialty which needs extensive clinical training. We cannot be a practicing clinician without having adequate clinical experience and investing certain number of hours in the training in a clinical environment. So that is what is lacking in our country, and because of which it stays an enigma, because it becomes a no man's land when there are not enough specialists from the specialty available servicing in the country. So there is lack of awareness. We are still struggling for pain medicine to be a specialty in India. Forget the orofacial pain part of it. So yes, we have a lot of work to be done in terms of awareness, understanding, and then probably it will not stay an enigma.
Oh, yeah. So talking about menopause, for most of the women, it is a very transformative phase. So how does this intervene with the conditions related to a jaw joint?
So menopause is a phase of transition for the female body physically, and it's the shift in the hormone profile. The jaw joint also has hormone receptors, and they change and they shift, and also according to Ayurveda, menopause the element of Vata increases, the air increases, and with this we have more of arthritic problems and problems which are destructive in nature in the body increase if we don't mitigate it properly. So we see those kind of things where jaw is getting arthritic We can manage and ride these things very successfully if we understand our problems in a timely manner, if we come to the right doctor at the right time, or if we understand that menopause is a condition which needs change in the daily routine that we follow, change in the diet that we follow, changes in the routine like what? Like, take frequent breaks from the work. Don't get overtired when you are working. Watch the hydration. It's very important to watch for hydration. Ruchika Sood, the star nutritionist, she talks very well on the nutrition aspect of it. I encourage all of you to listen to it carefully and try to follow it as much as possible. If we bring those requisite changes in the diet, it goes a long way to protect us from various problems. And also there are so many menopause clinics these days in specialty hospitals. It's always a good idea to run through the checkup and understand where you stand in terms of your own health, because health is a very dynamic thing. And also I would want to bring your attention to the mind aspect of it, because health is about mind, body and spirit. A lot of women struggle to accept the end of the reproductive phase of life. So if you need help in terms of coping mechanisms to accept that part, or there are fears and anxieties that you have with this aspect of life, it's always a good idea to discuss it with a good counselor.
Thank you, doctor. That was very much insightful. So coming on to the next main guide that we all normalize these days, stress. Stress and pain go hand in hand. But how does this chronic stress add layers to a woman's pain experience?
So chronic stress and pain go hand in hand because the broth or the hormones which is required for the pain, for the body to fight the pain, are eaten up by the stress. So if you exercise a lot, or if you are taking care of your norepinephrine levels at your synaptic rate by exercising adequately, doing certain wellness regimes for your body, you are able to cope better with a stressful condition. But that is the connection, that it eats up those neurohormones, chemicals in the body. But having said that, it's a bi-directional relationship. Sometimes when it's a stressful environment, it leads to painful problems, and sometimes when you are in pain for a long period of time, it leads us into a very anxious state of existence, and it leads to stress. But these things can be mitigated. What is of significance is the sequence of the treatment, the right diagnosis of the condition. It's not always in the mind. There are times when it's in the body also. So the mind-body axis has to be understood and deciphered and diagnosed by a properly trained clinician, and it's only then that a treatment plan can be put into place. So I really respect Ayurveda a lot in putting these things in a perspective for us. If somebody is a well-dominated personality and then they go out and exercise a lot, and they're creating stress for themselves, because the element which needs to be managed is getting enhanced. For this person, yoga may be a better idea because they need the calming effect more. For somebody who is a cough-dominated person and needs to exercise 3 times a day, is doing yoga all the time. So that's not adequate for them. It is very important to understand our own constitution, understand who we are as people, as person, where we stand in respect to our mind, body, and create our path from that spot. One rule for all is not a good idea. We see cases where people have tried to work with self-belief and become so bad with their body posture, and major scoliosis get in the back and upper neck, and jaw gets pulled out of proportion, mouth opening will get restricted. don't push yourself to such a point. Honor your body and honor your mind. Both are equally important. Understanding of the constitution, understanding of what you are is very, very important, and that's where the treatment plans get formulated. A lifestyle has to support your being. Yes, getting up early in the morning is non-negotiable. Circadian code has been written by nature. We have to wake up early in the morning and we have to sleep by 10 o'clock. It's absolutely non-negotiable part of staying healthy. That's another thing with menopause. If you stay up very late, your symptoms are definitely going to get worsened. We have to honor circadian code.
I think the practical tips that you have just shared will help us definitely find that relief and balance in life, along with the medical consult.
Yeah.
At the right time. Yeah?
Mm-hmm.
Okay, next, doctor, we'd like to talk about fibromyalgia, which is a condition with so many complexities. Can you just shed some light on it, about the challenges we face as women?
So fibromyalgia is a condition which is predominant in women, and it is spoken about a lot because of the nature of widespread pain. It's a central pain syndrome when we talk about pain problems, and I'll not get into too much of medical science of it, but the practical aspect of managing a condition like that is rest when required, don't overwork, try to detox the body, because what happens is that mitochondrial shortening happens in conditions like that. So the energy centers of the body are getting affected, and we have to somehow bring them back into function appropriately. Modern medicine has options in terms of medications and mindfulness. This helps us walk through the path, and alternative medicine also has many options in these. According to Ayurveda, this is widespread toxicity of the body, or the toxins which the body could not get rid of, the inflammation which is existing consistently in our body. It is possible to work by combi therapy and first find relief with modern medicine, and then try to work with Ayurveda to just get out of this condition and say bye-bye to it. And once again, there is no therapy which fits one size fits all. It is individual and it is customized. Just because some individuals can be treated permanently for it doesn't mean that everyone can be. It is an autoimmune condition. It is a condition which needs management all through. But the tips to manage it is honor your being. Don't get overtired. Take your medications on time.
Most of us these days, we just don't think that is necessary. But sleep disruptions due to pain are very common. And how do you think the sleep which is disrupted can impact a woman's life or a women's overall well-being?
Sleep and pain, once again, is a bidirectional relationship. You said sleep disrupted because of pain. It can be pain causing the disruptions in the sleep. Today, normal wala headache hai, I'm not honoring it, that I need treatment for it. So what is happening? The inflammation which is staying inside my body is staying. It's a matter of time where it has to come to a point where it will disrupt my sleep. So early recognition and acceptance of the condition is very important for us to live healthy. Delaying the management of the pre-existing conditions is never a good idea. Respecting sleep and as a necessity is again important. Staying online on different forums and drinking late till night and all these things that we talk about healthy living these days, they are non-negotiable aspects of life. We cannot be sleeping at 12 and expecting to stay healthy, because circadian rhythm works. The nature works the way it does. We have not been given the powers to change it yet. We can discover electricity. We can have the facilities to party till late, but no. So you see, the incidence of diseases in shift workers who work overnight is very high and different from the other regular people. Why? They are sleeping in the day. It's not that they are working 24 hours. But if we don't stay in sync with nature, we cannot be healthy. So sleep hygiene, keeping bedroom just for sleep, making sure that we have adequate hydration through the day. Yeah, these things are important. So sleep hygiene is very important. Our bedroom has to be maintained for sleep, same time of sleeping, having a relaxing activity. Half an hour, say 10 p.m. is your bedtime. 9:30 you should be in bed, reading a book, listening to some calming music. The lighting in the homes should preferably be dimmed and yellow, and bedroom definitely should be with dim lighting. These things, and then we can do yoga nidra practices if we still are struggling with sleep. It helps to put us to sleep. And yeah, these things kind of, if still you're struggling, then definitely we should see a sleep doctor. And obstructive sleep apnea, snoring is not normal. It's a health problem. It needs evaluation by the sleep doctors. And also there are a lot of other different types of sleep problems. So it's important to acknowledge and consider these problems as health hazards and diseases, and then get them corrected in time. If not, these are the problems which lead to problems like diabetes and blood pressure and a lot of other problems.
Okay. So doctor, talking about snoring, I think snoring has been very much normalized these days. You really think it has to be addressed? Because common man these days, they say, no, I just snore because I'm very tired.
Yes, it has to be acknowledged and understood. Just because everybody is sleeping late cannot become healthy. Just because so many people are snoring cannot be healthy. See, according to us, snoring happens because of the obstruction in the airway. You're not able to breathe properly when you are sleeping. So it's important to evaluate it in good time.
Yeah, that's very much important. Dr. Sood, now with your clinical expertise of more than a decade in orofacial region, orofacial pain management, which is something which deals with the jaw, face, head, neck and region, all the pain related to these particular region. What is that you have to say about the jaw joint, or also known as the temporomandibular joint, which is an invisible source of distress?
It's alarming if temporomandibular joint has to become a source of distress. It's not, it's the most adaptive joint of human body. So it's not one of the parts of our body which gives up so easily. So if this part of the body is giving up, we have to take it more seriously than most of us understand it. A little pain here and a little pain there can be ignored wala attitude nahi hona chahiye in problems ke liye, because this joint is by itself, by nature, the most adaptive joint of human body. There are two movements in the joint. We rotate and we come down, and this is about the only joint in our body which functions like this. So, did I answer your question?
Yeah, definitely. That was very much useful, Doctor. And now for our listeners who are seeking empowerment and proactive care, what practical steps would you say, or if they suspect that they're dealing with a chronic stress and pain?
So chronic pain has to first be acknowledged and accepted as a disease. Chronic pain means when you have been in pain for more than 3 to 4 months. Pain, by definition, is an emotional and sensory experience. When we are trying to understand our patient's pain problems, we count for the person. The same pain can be 5 on 10 for someone, and the same pain can be 1 on 10 for the other person. So somebody who is putting it at 5 on 10 is suffering at that level. It doesn't mean their pain is of any lesser than the person who is at 1 on 10. It's very important to understand pain as a disease, and then reach to the appropriate doctor and understand it. See, when you have diabetes, how do you approach it? There are certain people who will say, okay, fine, it's just about taking one pill, so I'm going to take the pill and I'm going to live my life the way it is. And then there are other set of people who say, let me control it with the medication for now, and what are the things that I need to do to make sure that this doesn't become a problem for me the rest of my life. And then they get into that fitness regime and they do things which are corrective. So for us also it's the same thing. If you are someone who's suffering with chronic orofacial pain, we'll understand your pain. We will diagnose your pain. Pain has many different diagnoses. So we will try to diagnose it for what it is. All facial pains are not trigeminal neuralgia and atypical facial pain. These are the only 2 diagnoses which are spoken about in our country, unfortunately, because of lack of training in our country. But there are a lot of different types of orofacial pain problems. So once you are sitting and talking with the clinician who is trained, and we have a couple of them in our country today. So we are talking with them, they will help you through the right diagnosis, understand the condition, bring about the lifestyle changes that support good health for you, understand the medication that is required to manage the condition. Because of the lack of awareness or lack of responsibility for health and attitude in our country, I see a lot of mixed patients, like having mixed meaning the same person but 2 or 3 different types of orofacial pain problems in that person. So a person may be having migraines, person may be having temporomandibular joint problem and a neck problem. They are all 3 different types of problem, but for the person who is sitting in front of us, it's only pain, right? So these have to be understood for what they are. So please reach out to an orofacial pain clinician if you are suffering with pain in these domains. Once you understand it, it's a tamed horse for you and you will be able to ride it successfully.
Thank you, Dr. Sood. Thank you so much for sharing your expertise and shedding light on the intricacies of pain in women's world.
Thank you. So we end here without chai.
Thank you. Until next time, this is Dr. Aksha signing off from Neocare Pain Aid. Remember, take care, be well, and join us for yet another empowering conversations.